afternoon, good evening to all of you joining from all over the world. I am thrilled to welcome you to day 3 of our first ever maternal mental health technical consultation. My name is Genesis Choresungani, and I am joining you from Malawi. I am the country representative for African Alliance on Maternal Mental Health. And I would ask members to visit the website of Africa Alliance on Maternal Mental Health to see more details on how they can join the grouping. Going forward, I am very excited to serve you as your day 3 facilitator for this important convening. During this technical consultation, we have brought together the maternal and newborn health communities alongside those in mental health community, sharing ideas and approaches to accelerate progress and elevate maternal mental health during the pandemic and beyond. A few housekeeping items before we get started: that we have simultaneous translation occurring from English to French and Spanish for select sessions. If you wish to hear the sessions in French or Spanish, please click on the agenda tab again and select the session title in your preferred language. We continue to be active on social media today and welcome you to engage with your fellow. Our TechCon hashtag is hashtag MMH alongside hashtag Maternal MH Matters and hashtag MMH. We are dropping this information and handles to follow and tag into the chat. There are multiple other ways to engage with fellow attendees as well. Just before this program started, we had another networking session, and we will have our last after the program concludes later today. This final networking session will also allow you to freely converse in English, French, or Spanish. There are also discussion boards where our colleagues are posting comments and questions and continuing the conversations from their sessions. And please do not forget that you can see who else is attending and direct message them by searching the participants tab. All sessions recordings for the past 2 days are accessible to audience members, and the recordings for today's sessions will also be accessible after this technical consultation. At any time, you can get in touch with us by navigating to the #technical support channel in the platform chat. All speaker bios are accessible on the platform, so you can read more about their work and the unique perspective they bring to this convening. Please note the Q&A box and the chat box are one and of the same, located immediately to the right of your video player. Okay, on to the good stuff. Yesterday was another day of exchanging knowledge and learning. We heard practical examples of successful collaboration between the maternal, newborn, child health, nutrition, and mental health communities, and found inspiration from one another in our commitment to being candid and challenging ourselves to ask tough questions and be real with one another. We heard even more ideas for how perinatal mental health programming can be integrated into primary health care and incorporated across the continuum of care for the benefit of women and families, and how this is especially critical in fragile and crisis-affected contexts. Our first session was focused on fostering collaboration with the Ministry of Health colleagues and counterparts to work hand in hand with us to make this work a priority. The important role that advocacy plays and that every one of us can be advocates. This week, we have become advocates. We also discussed the need to strengthen provider capacity to support the provision of quality maternal mental health care at the facility level. But there are challenges in doing so when there is a shortage of mental health care providers. We heard examples from Nigeria and Liberia that featured maternal mental health training and service provision interventions that increase task sharing and capacity building so that there are more trained personnel. We openly shared the critical risk factors, with gender inequality being arguably of the most important. We spoke of the need for a multi-sectoral approach that leverages the unique role of community and faith-based actors and organizations. We know that male engagement and gender transformative programming is essential to reducing the incidences of common perinatal mental disorders, and yet most of our programming does not involve this. Our programming must fit into the socio-cultural context of the communities where they are being implemented. We shared experiences on integrating maternal mental health into existing small and sick newborn and nutrition interventions. We have been working to convince healthcare providers that integrated approaches are critical, and now we have the evidence to share as to its effectiveness. Our respective communities have been trying for quite some time to make the case that the child survival is linked to maternal mental health, and that if we don't invest in maternal mental health, we will not create an enabling environment for children. And now we have the evidence to support this. In the perinatal trauma session, we learned more about the impact of traumatic perinatal experiences on maternal and child health and development and strategies to mitigate their impacts. We had lived experiences of unanticipated obstetric events, mistreatment during childbirth, and perinatal loss, as well as community-generated strategies to mitigate trauma. As our colleague and friend Wanjiru stated, and I quote, "It takes a village to raise a child. It also takes a village to care for a bereaved parent," end of quote. And that's powerful words indeed. Sessions also underscored the critical role of community, civil society organizations, and faith-based partners in efforts to increase awareness of strategies targeting care for common perinatal mental disorders. When mothers have access to the right interventions and the right support, both from the community and their families, especially spouses, mental health improves significantly. But much more work to increase this awareness and understanding must take place within the communities that women live. And we were able to learn from colleagues in the respectful maternity care movement, their experiences and lessons learned that bring us closer and further in our journey of a truly global action plan around maternal mental health. How important it is to support providers in providing care, but also supporting their own mental health. We closed the day with the opportunity for participants to join a special session on measurement and to engage directly with one another through our social networking session, where you would also informally network amongst yourselves and discuss what you have been hearing. We also had some of you participate in the social hour just before this session, and we look forward to having you to continue to use the last social hour later today as a way to get to know one another better, learn from one another, and challenge each other. As our colleague and friend Benedette said in her session, I quote, "If you do nothing, do something. If you do a little, do more. If you do a lot, do better. The tools are available and it is up to us." I feel that sentiment sums up our learning so far during this technical consultation, and our shared commitment is to do something and do more and do better. With that, it is my pleasure to introduce you to our first plenary of the day, which will further get us excited for this movement and how best to align existing global and country efforts to accelerate the maternal mental health agenda and move the needle going forward. I would like to introduce Pandora Hartman of JAPIGO, who will be moderating this esteemed panel and lively discussion. Pandora serves as Chief Nursing and Midwifery Officer at JAPIGO, where she has brought her 20+ years of nursing midwifery experience working in the US, Caribbean, Southeast Asia, the Middle East, and Africa in varying capacities assisting women. Pandora, please, it is my pleasure. Please take us away.
Thank you for that review and warm welcome, Genesis. And I'd like to welcome all of those of us gathered here today for what I don't want to think of as a final plenary, because this is just the beginning of a discussion that we hope will carry forward and continue to disperse all over the globe. For our session today, we are bringing together an amazing range of experts in the field who are going to help us orient a little bit more to the WHO Mental Health Action Plan and look at what are some of the global efforts from leading organizations such as the UNFPA, UNICEF, and the ICM, and also most importantly, I think, bringing together our grassroots effort so that we can begin to strategize around how we are going to align this movement globally, countryly, locally, neighborhood-wise, to really drive this maternal mental health agenda forward. So we're going to hear perspectives of what we think that looks like. Hearing calls for accountability, because we do know that this is total impact, the entire family, not just women, but children for many generations to come. We have joining us today, Dr. Devorah Kestel, the Director of Mental Health and Substance Abuse from WHO Geneva. We have Annika Knudsen, who is the Chief of Sexual Reproductive Health Branch in UNFPA New York. We have Zainab Hijazi, Senior Mental Health Specialist from UNICEF New York. We have Franca Caddy, who is our esteemed president of the International Confederation of Midwives. And we have Pascaline Najou, founder and executive director of the Calm Mind Foundation, Kenya. What is interesting, I think, even you'll notice about this group as we get to talking, they may be in one place, but have hailed from another. And that in and of itself brings our diversity together in how we are going to address maternal mental health moving forward. We will start our panel today by hearing from Dr. Devorah, who will introduce us to the World Health Organization's Mental Health Action Plan. Over to you, Devorah.
Hello, good morning, good afternoon, good evening. My name is Devorah Kestel. I'm the director of the Department of Mental Health and Substance Use at the World Health Organization. And I want to thank you the opportunity to introduce you to the WHO Comprehensive Mental Health Action Plan, which provides a framework that can be very useful when we think about the actions required in aligning a movement for maternal mental health. In 2013, WHO member states agreed on a mental health action plan that was to be finalized in 2020, but a couple of years ago, member states decided that we still had a lot of work to do, and therefore there was a need to extend it to 2030 and to have it in this way aligned with the SDGs. But in the meantime, we were requested to work with member states to update the two appendices of the action plan. The action plan then, as you can see, has a very ambitious vision, basically talking about a world where mental health is valued, promoted, and protected, mental disorders are prevented, and people with mental health conditions can exercise their human rights and access the highest quality of care possible, allowing them to play a role in their communities, in the societies at large, without stigma and discrimination. The goal is about mental health promotion, prevention of mental health disorders, with emphasis in recovery, human rights, and the need to reduce mortality, morbidity, and disability for persons with mental disorders. There are a number of cross-cutting principles that are relevant to maternal mental health. For example, maternal mental health interventions for treatment, prevention, and promotion need to be based on scientific evidence and best practice. In thinking of universal health coverage, we want to ensure that all women have access to affordable, quality health care for both physical and mental health that is free of shame, stigma, bias, and discrimination, and that ensures protection of their human rights. An effective approach for maternal mental health requires a comprehensive and coordinated response for mental health in partnership with multiple sectors such as health, education, employment, justice, housing, social, and any other relevant sector. Each objective of the action plan is also specifically relevant to maternal mental health, and I will go over some of these in the next few slides. The primary focus needs to be to align and to integrate the mental health and maternal health agendas to address women's needs during the antenatal and postpartum period, but also during pre-pregnancy and for long-term health. This will need health system innovation with universal health coverage as the guiding principle. Addressing social determinants while also focusing on treatment and care will be the pillars of such a comprehensive response. Let's look at the objectives then of the action plan, the mental health action plan, to see how they relate to the maternal mental health. The first objective, to strengthen effective leadership and governance for mental health. The key actions here are developing and strengthening policies and laws, resource planning for mental health, and stakeholder collaboration. All of these, as you can see, relate to maternal mental health. Improving maternal mental health care requires policy and legislative changes within and outside of the healthcare system, including increased funding for social services and support to help address social determinants of health and remedy the negative health impacts of systemic discrimination, including discrimination based on race and gender. Resource planning would be facilitated through fundraising for mental health and also redirecting available resources towards primary health care and community-based services to integrate mental health care into existing sexual health, reproductive, maternal and child health, and youth and adolescent health services. Cross-sector stakeholder collaboration to improve access to education and employment, social protection, and to prevent violence against women are also essential to maternal mental health. Objective 2, to provide comprehensive, integrated, and responsive mental health and social care services in community-based settings, with actions that are included here that are related to service reorganization and expanded coverage, integrated and responsive care, and human resources development. Comprehensive and integrated primary mental health care is a concept that takes into account the complexity of the interaction of physiological, social, and psychological factors for mental health care provision at primary and community levels, offering a solution for addressing maternal mental health. Integrated maternal mental health interventions would include routine mental health screening that could be incorporated into physical health screening procedures at community and at primary healthcare level, and the management of common perinatal mental disorders by non-specialized staff, including delivery of psychosocial interventions. Intervention programs for maternal mental health can be part of the routine antenatal and postnatal care packages. Building capacity of non-specialists with training and supporting supervision can increase the workforce for delivery of quality maternal mental health services. Objective 3, to implement strategies for promotion and prevention in mental health. Mental health promotion and prevention intervention packages can be included in the core services provided across a range of sectors to address the particular psychosocial challenges and vulnerabilities associated with the perinatal period. This can include education programs and supportive counseling for all women as a universal intervention. It could also include structured psychological treatments for women at risk, for example, women who are identified as being particularly vulnerable to common perinatal mental disorders, such as women with previous depressive episodes or those experiencing social risk factors that may have an impact, like low income, intimate partner violence, and adolescence. And suicide prevention is particularly important during the perinatal period, given that suicide is an important cause of maternal mortality in low and middle income countries, with up to 20% of mothers experiencing suicidal thoughts or undertaking acts of self-harm. The last objective, Objective 4, to strengthen information systems, evidence, and research for mental health. Strengthening health information systems and collection of population-level data on maternal mental health will provide input to improve service delivery through the use of evaluation of evidence-based or promising interventions. There is a dire need to conduct implementation science research in low and middle income countries, testing efficacy and effectiveness of needed tools and interventions at community level to improve maternal mental health. It is very important to involve practitioners and people with lived experience as equal partners in research. What we do through this, the Mental Health Atlas project is we monitor progress of the implementation of the Comprehensive Mental Health Action Plan. And very soon we will publish the Atlas 2020 that has collected information from 171 WHO member states, 88% of our member states, that despite the challenges during COVID-19 were able to provide information for this exercise. So don't miss the coming Atlas. In 2019, and to conclude, we launched the WHO Special Initiative for Mental Health called Universal Health Coverage for Mental Health in an effort to demonstrate how to increase access to mental health care is possible. So we are supporting countries. We are working with colleagues in 7 countries right now, and others are being added. Support them in their efforts to make this access a reality. And I hope that we will see more and more maternal mental health components in those special initiative countries, as we call them, in the near future. So I thank you for your attention.
Thank you, Devora, for giving us that overview of the WHO Mental Health Action Plan, and for giving us a quick glimpse of some opportunities that lie within for further action. It's interesting that we're even having this discussion in what is the US National Suicide Prevention Week, and we're talking about how to action things forward. Wow. With all of the background that she sent, I'd like to pose some questions to our panelists. So when we're thinking of that phrase, what does it mean to you when we talk about aligned maternal health movement? What does that look like to you? What are your thoughts on essential pieces that are going to be needed to drive this forward and drive this home? Panelist? Annika, your thoughts?
Okay, thank you, and good morning to all. I'm really excited to be here and part of this discussion because it's been so neglected, as we've heard over the past few days. And I think, to your question, I think it's really important that we think of ourselves, all of us, as stakeholders and as partners in moving this forward. I think this consultation is a very good step forward. And I think Genesis summarized it very well in all the discussions that have happened, because the causes of mental health conditions, perinatal, are really coming from all sides of our lives, not the least the broader SRH lives that we lead before we get pregnant and before we give birth. So I think it needs us all. And it needs us also in the terms of thinking about our own beliefs and perceptions around mental health and how that influences us, because that also influences how we acknowledge that this is really an important part of the holistic care that we provide as midwives, as doctors that come in, as the team around the pregnant and the birthing woman. So I think in more concrete steps, I think that a joint global advocacy with all relevant partners is really important. But I think also that we need to really focus on the evidence, and we need to normalize, and we need to not over-medicalize. When you turn focus to an area and everyone focuses on that area, there is a risk that we also overdo it, that we don't see that the normal part of a process. And I would like to emphasize that the perinatal mental health is a bit different in how it expresses itself and how it's also, treatable, and how there is a process in that. So I would like to compare it with midwifery, as we follow the woman, and I think there's a lot that we can do with working with the health workforce, and I can say something more about that later. But I think we need to find entry points for integrating it in ongoing ANC, PNC, adolescent SRHR, and family planning programs. So I'm really happy about this framework. I think it takes into account all of the things that I mentioned here, but happy to hear from reflections from the others as well.
Panelist, what are your thoughts? Please do join the conversation.
Yeah. Thanks. Yes, good morning, everybody, or good afternoon, depending on where you are. And this is such an important question, and one that speaks to what I see honestly as something already in the making. An aligned maternal mental health movement means that UNICEF, WHO, UNFPA, ICM, and our partners at all levels, global, regional, and country level and local levels, adopt and drive a common approach to maternal mental health, one based on evidence and research. And this movement would, represent a significant paradigm shift that is more closely aligned with the multi-sectoral life course and strength-based principles of mental health for children and families. And of course, the movement must have a transformational effect on workforce development, and should essentially be a watershed moment for programming and the field. And the common approach of this movement would build on, the evidence that we've all become so familiar with, the absence of parental attachment and nurturing caregiving in early childhood being one of the major drivers of mental health problems that become and manifest in adolescence. We now know that unaddressed parent and caregiver mental health problems from pregnancy to adolescence can have a lasting impact on children and young people's long-term emotional and physical development. And, we know the staggering statistics that, 1 in 4 children live with a parent who has a mental health condition, and adolescent mothers are at particularly high risk of developing mental health conditions like depression. And so our united approach and movement must support caregivers' knowledge and capacity in ensuring nurturing care and positive child and adolescent mental health development throughout the life course. It must ensure that caregivers have access to support and services that support their own mental health and well-being and provide responsive care so that they are able to provide responsive caregiving to their children. And the movement must prioritize advocacy, as Annika said, and awareness raising to reduce the stigma associated with maternal mental health issues. And at the heart of the movement must be workforce development. This is such an underlooked area. I think we need to be looking at ensuring healthcare, community, and social protection providers have the capacity, tools, and resources to address maternal mental health, but also ensure support for the mental health and well-being of them, the providers themselves.
May I add to that, Pandora?
Absolutely.
What I feel that's one thing that we're missing when we're talking about working together as a team, and hi everyone, by the way, I'm sorry, just going straight in there. Wonderful that you're all at this panel and willing to listen to us. But what I do feel we're missing is that if we want to align, we have to align with the people that we give the service to. And I think that this is a real shift, because it shouldn't be something that we just say, but that mainly women we're talking about, and their children and their communities, and their contexts are so different from one to the other, but they should really all be part of the care that we give right from the start. So when we do implementation research, women should be at the table talking about it. I think women often do know, and people that we're giving care to know what they need. And we really, really, as a health workforce, need to realize that we are there to give that service, and people do know what they want and what they need. And I think it can't be overemphasized. I mean, I can talk about this for ages, but I think that it's a real basis. And for that, you also need trust. Trust is not an easy thing, but trust is so crucial. Trust within the team, for all the team members that trust each other for their skill, trust in the woman that she knows what's best for herself, trust of the woman, of the healthcare professionals, that at times they might intervene and that they have, their best intention and they're able to give each other feedback. And for that, I really think you do need some kind of a continuity model. So the care has to be community-based, small scale, so that it is possible to actually get to know the caregivers, so that people meet each other as people. Because of course, a woman with a mental health issue is first and foremost just a woman. And we all recognize healthcare issues. All of us here listening will have either had serious healthcare issues or healthcare issues that we've been able to deal with. And it's only when they become very, very big and really dominate our lives that they become healthcare problems, but we all recognize them. And I think that too, integrating mental health into our daily lives, into our daily care. It is not a separate thing, it is part of everything. And I feel that that is the kind of way that we should be educated. That's the way we should talk to each other and challenge each other when we're giving this care. Thank you.
Thanks for that, Franca. I think this is a great time to pull you in, Pascaline. I'm going to throw you on the hot spot here, because we know that your organization was founded to create that support and to connect the women at the ground level for early identification and to manage this maternal mental health spectrum. What are your thoughts on aligning and perhaps some of the comments that our other panelists have said?
Thank you so much, Pandora, and good morning, everybody, and good afternoon to those who are in the afternoon, like myself. So yes, I founded the organization Calmen Foundation for that reason, to promote maternal mental health, and our work is basically on the ground, community level. And so for me, an aligned maternal mental health would mean a movement that is made up of actors such as national, regional, international civil society organizations, non-governmental organizations, faith-based organizations, healthcare workers, community health workers, people with lived experience, and maternal mental health advocates, amongst others, across the world who are passionate, well-informed, and dedicated to the promotion of maternal mental health. A wholesome kind of a movement. That's what I'm looking at. And what would be needed to forge it? I would say the first thing that would be needed is to form an umbrella body that leads the movement. So this body becomes like the host of the movement. Secondly, I would say to identify different promoters of maternal mental health in the different countries across the world, and then bring them together in the conversation and the agenda to work towards the same goal. And I would want to give an example of what Postpartum Support International does. So every year, once a year, just about in May, just before the World Maternal Mental Health Day, PSI has what they call global partners. So just before the day, we normally come together, we talk about what activities we each have, and it's across so many countries. So what that means is that by the time we are getting to the week and the day of the World Maternal Mental Health Day, we are having a force that is working in their different respective countries to make sure that the voice on maternal mental health is amplified, and so much work and activities are ongoing in the different countries. So I think that is a good example to give of a movement across the world. And then I think the other thing that would be necessary is to educate and have all the actors well informed on matters maternal mental health, and the gaps that exist in the provision and availability of the services. Having passion to see something done in the maternal mental health is good, but it's not enough. Without education, without information, you might not exactly be very effective in giving results. And I'll give the example of myself. I am in this field because I went through postpartum depression. And because of the pain that I went through, the stigma, the discrimination that goes around maternal mental, any mental health, I felt the need to do something when I recovered. And so for me, coming up with an organization was out of just the willingness to do something in this space. But you see, I did not have the kind of knowledge that I would require to make a difference, because my background is law. I'm a lawyer by profession. So what I did is that I have gone through a lot of training. I've empowered myself so much with information, and I can sit and talk in such a platform and talk about maternal mental health with confidence, because now I understand the gaps, the challenges that the mothers on the ground are going through. So I think having actors who are very well informed, even as much as they want to see something done, but they are also very well informed in this area, is very crucial and very important. And those are the things that I would say are important to have this movement forged and moving forward. Yes. Thank you, Pandora.
Thanks, Pascaline. Well, it's striking me that you're talking about using the lived experience to align a movement. And I think if we look even outside of maternal mental health into so many movements that have transformed the world, people channel their experience and who they are to whatever topic. Yes. Really, really food for thought that you've given us today. Devora, what are your thoughts, wrapping all of this around some of the work that WHO?
Thanks, Pandora. I think it is great from our perspective to see this increased attention from different partners to this area of work. Mental health has been and is still neglected. So it's great to see all this moving up. And then alignment, I would say that for us means speaking about different forms of collaboration between all stakeholders to work together to provide the best quality care for women. And the collaboration will only be possible if addresses and respects the visions and the needs of everyone involved. So the key issue then is communication and bringing all stakeholders together on a common platform like the one we are having right now to frame priorities and actions that are needed, and that will make a difference in the lives of women. Share responsibility in planning, implementation, monitoring, but also then shared goals and objectives, so that mental health is seen as part of women's health, from health promotion to prevention to treatment, care, and any step of the way, and that we do this by being together, by working together, by being successful together, so that we can say we we are doing this and we respect each other's priority, but we do it together. And if we succeed, we all succeed together. Any of us succeeding will succeed. The project will succeed. The women's mental health will be much better. Over to you.
Thanks for that, Devora. You're pulling us, I think, into another reflection point and looking at what the mental health action plan is. My thoughts are turning to what might it look like, opportunity-wise, what perhaps even thinking of our partners, ICM, UNFPA, UNICEF, what actually are some of the initiatives or efforts that your respective organizations are focused on that might pull the pieces of the action plan and efforts together? Franca?
Thank you, Pandora. I think that what ICM is doing is, first of all and foremost, working with our partners, understanding that we are not alone. And that is no small thing. I think we really need to all realize our own place and what we are good at. And I think as ICM, we've really worked on understanding and working with our partners, because that's the only way you can move forward. Besides that, as you well know, of course, we're working on trying to implement midwife-led continuity of care. And some people misunderstand the midwife-led part. They look upon it as being midwife-ruled. But midwife-led or midwifery-led means that you have a certain philosophy of care whereby you work together as a team. And we often put a lot of focus, don't we, on teamwork. And we say, the team is so important. And yes, the team is crucially important. But in our patriarchal systems, often it is patriarchally, hierarchically, one person, often the medical doctor, who is the head of the team. But I think that you need to look from point to point, who is the most important to lead that team. And I think leading from an idea of prevention, leading from an idea of continuity, of trust is really, really important. So as ICM, we're working at, on the one hand, being an important team player, standing in the team, playing our part in the team, and at the same time, trying to introduce midwife-led continuity of care, because midwife-led continuity of care means that a woman will get to know her midwife and whoever else is needed, because of course it's a team. And with that, I think we'll be much more able to understand the context of the woman, what she needs, where she's coming from, and we'll be able to prevent much better. So I think that is one thing that ICM is really working towards and trying to help understand. And this might not look like it's specifically about mental health, but mental health is a part of health in general. And only when you integrate it, and within this continuity of care model, mental health is integrated, and you'll be much better able to refer to who you need. I think that is one of the most important things that we as ICM is doing. Of course, we're also currently supporting the WHO guideline review of postnatal care. That too has a very specific section about mental health, maternal mental health. And again, of course, it's great that it's specifically mentioned. But again, I do think we need to understand that it's integrated in the care in general. So that's some of the things that we as ICM are doing. Thank you.
Maybe I can jump in here, Pandora, is that okay? Following Franca, because I would like everyone to keep in mind exactly everything that Franca said, and then I'll talk a little bit more about other specifics that UNFPA does. So one of our transformative results and goals is to end preventable maternal deaths for the whole organization. And that includes, of course, the deaths and the illness and the conditions that happen around perinatal mental health as well. And we have really started to seriously address this area and mainstream it into the global midwifery program. So with the focus on all that Franca was mentioning is so important, and it's great to be on a panel where you can just follow on each other, really to advocate around this issue, but also to strengthen the capacities of midwives. Not only midwives, but the team, as we've been speaking of, but we are really into midwifery and strengthening midwifery in UNFPA. And, sadly, the impetus of focusing more has come from COVID and all the, increased need for looking at the mental health and well-being in relation to the increased teenage pregnancies, in the relation to the increased gender-based violence issues that also impact perinatal maternal health. So mental health. So we recently created a module on perinatal mental health, and we have piloted that with midwives in our Asia Pacific office together with Burnett Institute. So that's one concrete examples. And what we have seen is that the countries where it's been piloted, they have drawn up action plans for cascading, training, and mainstreaming in the health policies. I also would like to address one issue that we haven't touched so much upon, and that is the need for support to midwives so they can actually provide the care that they are supposed to provide with respect to women. And so the issues that arise from poor midwifery care or poor maternal perinatal health care should not be underestimated. And UNFPA has worked to put forward what we now in some terms call obstetric violence, not to put the blame on the health workforce, but really to look at over-medicalization. What does that do to women when their voices are not heard? So I have a lot to say on this, but I also wanted to say that in mid-October, we'll have another panel with the Woodrow Wilson Center on maternal mental health. So just a few things that we're doing right now.
Annika, can I just add one little thing to that, which, yeah, we're just bouncing off each other here, but I think that another thing you're talking about obstetric violence, which I know some people have issues with, but women call it that. And I think that one thing that we've not realized is that we focused a lot on keeping women alive. And we have not really focused on making sure that we live a life, because life is not about staying alive. Life is about living a life and about respect. It's interesting when we looked at the What Women Want campaign from White Ribbon, you know, women spoke about the first thing and the most important thing they wanted was respect. And I do think we need to realize that in our very, very right kind of struggle to keep women alive, we have often, I think, gone over what they really need and want. We've over-medicalized and also under-medicalized. And because of that, I think we've had many issues. We must remember our care. The first thing we have to remember when we do our care as healthcare professionals is, first of all, do no harm. We have to really make sure that women and communities can live a life and are not only just alive. Thank you.
Zainab, I know you've been edging to get a word on here as the conversation has just taken off.
No, it's so great. And I such inspiring words, Franca. Thank you for that. I'm honestly very heartened by this group and how aligned we already are in our efforts. We have a long way to go, and we can only get there through our collective and aligned efforts to maternal mental health. And, you know, at UNICEF, we are playing a part and have made mental health an advocacy priority across 190 countries. And as part of this, we are focusing on key accelerators to promote mental health and well-being, one of which is to call on governments to support families by rolling out parenting programs to promote positive parenting and nurturing caregiving, and to support caregiver well-being and mental health. We support the advocacy with concrete technical support to countries implementing policy shifts and reforms that protect the mental health of children and their caregivers. And at the programming level, you know, UNICEF provides targeted support to vulnerable groups, including persons with HIV, adolescents, including adolescent mothers and others. And this has proven really as an important opportunity to reduce gaps in access to mental health information, care, support, where inequities disproportionately worsen mental health outcomes for mothers. We are also working closely with governments to enhance their capacity to promote and protect caregivers' mental health, which is really a prerequisite for optimal child development, including their mental health. And as part of these efforts, we will launch in the coming months an evidence-based training package for frontline workers called Caring for the Caregivers, or CFC for short. This package has a a specific focus on adolescent pregnant girls, women, and parents. The CFC approach has been validated through implementation research in 8 countries across several regions. We, heard colleagues here talk a lot about, how locally informed some of our initiatives are, and we have been really lucky to have had the resources to establish and validate our package in Bhutan and Zambia and Serbia, Rwanda, Brazil, Malawi, and Sierra Leone. And the CFC aims to essentially build frontline worker skills in strengths-based counseling to increase caregivers' confidence and help them develop stress management, self-care, and conflict resolution skills to support their emotional well-being. And I mentioned the advocacy piece and the programming piece, and really these advocacy and programming initiatives go hand in hand with research and data and policy work in this space that are really a core part of UNICEF and our partners' mental health acceleration initiative. So those are my my 2 cents, and back to you, Pandora.
Thanks for that, Zainab. And as the conversation is going, I just have to interject that we can't forget about the social determinants of health. Because, as we're talking about the advocacy and our partnerships, making sure that we're pulling every level of partner, because so much of perinatal mental health has to do with the fact that maybe you just can't pay your bills or you didn't want this baby. And looking at that, Pascaline, I know you're there at the grassroots level, working with women, hearing from women, bringing their voices alive. What would your advice to make sure that this conversation remains centered in women, remains centered in all of those pieces that are a woman's life, that we as women can drive the interventions, not just women as caregivers, right, but women as receivers of care, and that we're treated with the dignity and respect that we deserve?
Thank you, Pandora. Yes. Thank you, Pandora, for that. I want to look at it in 3 different ways. And one of the ways that I think we can have this happen is, one, by ensuring that the organizations and the people who are leading the conversation and promotion of maternal mental health, these organizations are 70% or more women-led. And I will give an example of organizations such as those that promote persons with disability, for example. I have seen when organizations are led by the people who understand best the issues that they're trying to address, it means that it comes from a point of understanding. And so the things and the programs and the projects and the initiatives that we come together and form are not just things that we think would work, but things that we do understand would work. And so having women lead these sort of organizations, I think would be very, very helpful. And the other way would probably have funders, encourage these by funding organizations that have this kind of leadership, because then it means that their organizations will take upon themselves the initiative to want to have the women in leadership. And then we, in turn, hopefully we'll see projects and programs, that come to help and to solve the situations at hand, or to solve the maternal mental situation on the ground. And the other way I would suggest is through educating women in positions of influence. And I want to give these my 2 examples. One of the examples is when we, as an organization, Carmen Foundation, tried to push for the inclusion of maternal mental health in the Mental Health Amendment Bill in Kenya. And it was very, very difficult for us to be able to convince the parliamentarians and the health committee that it was important to include maternal mental health in that bill. Because to them it was, so this is maternal mental health, it's an area of mental health, so why do you feel the need to have this included? But to us, we felt the need because we know that this is an area that has been forgotten, and if it does not go down in law, then it means that we will completely forget about it even in the provision of services. And so one of the things that really helped us was because one of the parliamentarians, who was a lady, actually came out and spoke and said, I have actually gone through postpartum depression, so I understand what she's talking about. I understand why it's important for us to have that provision in the bill. And it was picked up. It actually is now in law, and the bill is continuing the process in Parliament. So I think the fact that there was a woman in the room to actually bring out the live a situation, it was picked up and it was more live and they understood. So having women who understand maternal mental health and are placed in positions of influence, I think would really also be helpful. I also know, and I would also want to give an example of another situation where we as an organization approached another parliamentarian because we support women. And so we get to listen to the ladies who we support. And one of the areas was from ladies who give birth to, who go through stillbirth or lose their children during delivery, and the kind of circumstances in the healthcare provision in the facilities that predispose them to getting a mental illness because of the conditions that they're exposed to at the facilities. And when I approached a senator called Senator Sylvia Kasanga and told her, this is what the women are going through in these facilities, what can we do about it? She was very quick to understand the situation. And she actually went ahead and came up with a motion, and it is currently under debate in the House. So I think having these kind of women in these positions also help us to, also pick up this conversation, at a certain level, which also brings about fruits at the end of the day. And then the other way I would also want to look at a way of ensuring that women are in this conversation is crafting programs and projects as organizations that are women-centered, that take a women-centered approach. And what I mean by this is, as an organization, when we sit down and come up with our programs, what we do as people who are already in the community, we first approach these ladies and try to understand what is it that they are going through in regards to their mental well-being, the expectant ones, the new moms, what are they going through? And trying to understand from questioning them. And then once you have listened to them, when you come back and have your meetings with other organizations, then you are able to come up with projects and programs that truly understand what the issues you're trying to address are, as opposed to sitting in boardrooms and thinking what we think would help them. But instead of doing that, we are going to seek out information from them so that we are able to understand the correct challenges that they're going through and formulating programs and projects that will eventually be productive and helpful in the promotion of maternal mental health. So those are the ways Pandora would want to mention. Yeah, that I think an initiative for maternal mental health would ensure that women are centered in the conversation and the promotion of maternal mental health.
We appreciate your fierce championship at every level, from the boardroom straight to the rooms of the women that are with us. The time is flying by so fast, everyone. We've just scratched the surface. So from each of our panelists today, we thought we would have room for more, but I'm going to have to pull you back to one recommendation. If you had one key thing to say in our last few minutes about how we align this movement for mental maternal health, what would it be?
I've been quiet for a while, so I'm going now. Okay, so I think that very straight to the point, we need to make sure that we are providing support to countries, partners, and organizations. There are a number of guidelines, evidence-based guidelines, and technical guidance, and we involve people with lived experience, and we make sure that we make the best out of that. We learn from what we do in those countries, and we move to other countries with a similar approach. Thank you. Over to you.
The learning never stops.
And following on Deborah's really great recommendation, and I have many to give, but given I only have one, I would say we really need to be supporting evidence-based advocacy efforts aimed at nurturing adequate, efficient, and equitable budgets and spending towards this agenda. I think it's really appalling how underfunded this area remains. So I think we need to work better and harder at this.
So here comes one composite from myself. So I think we need each other to normalize and remove the stigma. And we need to use the mental health framework that Deborah so eloquently described for us. I think there is a wealth in there that we haven't used fully. So I really would like to call on us all to do that, because only then, and with a multi-sectoral approach, with a life course person-centered approach that starts with the adolescent already in their first encounters with sexual and reproductive health care can we get to the bottom of this, and can we integrate it? And I think I would also like to acknowledge the discrimination that people that are put in boxes called to have mental health conditions end up in. And thank you, Pascaline, for bringing that forward. It's really a huge burden, extra burden on women. So let's get rid of that discrimination now. Thank you.
It's really hard just giving one. You're really being quite strict, Pandora. On top of many others I have, I do think that we as healthcare workers should understand respectful care. So we should have training in respectful care for each other, respectful care to the people we serve. And I do feel that the workforce should also be reflective of the community that we serve. Women should be able to recognize themselves in the people that take care of them. So we have to be very careful of that as well. Thanks.
Okay, I think Pandora can go next. I also have quite a number, but I can stick to the one. And I think my recommendation would be to make sure that we have we are very particular about bringing the grassroots organizations on board in the movement. I think that is very critical because grassroots organizations have a first feel of what mothers are going through and what the issues that we're trying to address are about. So I think it's very important that even as we think around who to bring on board in the movement, that we make sure that this specific group of people is not left behind as we move along. That would be my recommendation.
Well, Franca called it strict. Thank you for that, everyone. I'm calling it accountable. I'm being accountable to the clock. And because accountability is going to be the key thing to make this movement stay and go. So my version is, actually, we do have to look at the clock, but what does that mean to everybody when we're thinking about what collective accountability means? When each of you walks out of this room to your organizations, how do we keep that framework? Food for thought. What are your thoughts, Annika?
I was already unmuted. No, I just think it's hard work ahead and not lose track of where we're going. And we need to keep each other accountable for that and really look at systemic approaches and not be diverted into smaller projectified, because it's what we need. So let's keep ourselves accountable to that with the person in the middle.
And I think I jump in and say also, I mean, with regards to accountability, we talked a lot today about how, we need to be accountable at all levels, UN agencies, civil society, people on the ground and practitioners and so on. I would even add to say, it is a multi-sectoral accountability. I think we often talk about the healthcare sector and their role in this space, but let us not forget the importance of, the education system that works so closely with mothers and caregivers, or social workers who engage in case management and are really on the front line and able to detect and assess issues related to maternal mental health, and are often the first ones to respond and need to have the knowledge and the skills to be able to manage those issues and also make important and adequate referrals. So it is a whole of society accountability, and I hope that we can enforce that together.
I would really like to see us all work together in such a way that we can give each other feedback, seriously, organization to organization, person to person, whereby we can hold each other to account. Because we say this, but often with power dynamics and things like that, we find it hard to truly say from one organization to other, or one person to the other, look, we need to do this together, or why is this not aligned? Or, hey, great, what you're doing, fantastic, can we join? Because of course there are many good examples, and being able to join the good examples and ask to be able to join, I think, is also a really important thing, because sometimes when great things happen, people want to keep them for themselves, but we need to do it together. So I think having this openness with each other, and certainly as ICM, we really want to be able to hear what others think we could do better, or which things they think we do well, and to join the movement together and be open in that way. Back to you, Pandora.
And if I may, then it's hard to add anything, but I was thinking when we work at country level, we try to collect data, we monitor, we do evaluation in order to make sure that things are moving, that there is some accountability there. And so the same approach is valid for us. We need to empower all stakeholders and make sure that we follow on what we are saying we are going to do. And we also support each other in order to make sure that we push together into the same direction.
Okay, Pandora. I can also I can also say what collective accountability means to me. It means that we as organizations need to be accountable enough to stay committed to this cause, and just understanding that we are working together, that we need to cooperate and to collaborate, because eventually that is how we are able to deliver and get tangible gains. So it's all about working together, just holding on to what you are expected to do from your end, and then know together, bringing, working together to bring those tangible gains and results at the end of the day.
Wow, this has been an amazing conversation. I feel like we could keep on talking for days to come. And it is my hope that as we have stimulated, hopefully those out there listening to us, to think more about aligning a movement for maternal mental health, that this will continue to be a hot topic. In summary of all that you've said today, here would be my takeaways for how to align a movement in maternal mental health. I think we need to say it. Just say it, addressing our stigma, stuff, systems, services, addressing ourselves. And most importantly, we got to stick to it, because we didn't create this in one day and we cannot fix it in one day. By sticking to it as a combined, accountable collective who ultimately believes all things are possible as we seek to build and grow this movement. Thank you all for your time. Thank you for those of you listening, and we look forward to the next steps. Be well. Signing out.
Thank you, Pandora and esteemed colleagues, for that inspiring and informative discussion. We have been energized, and indeed we have added voice to the silent burden, and indeed will not leave anybody behind as we move towards 2030. Now we have to get moving on to some other exciting sessions on our agenda. We have several concurrent sessions that will start momentarily. Please go ahead and follow the agenda to select the session of your choosing. As a reminder, all sessions are being recorded. So while you have a tough choice today in choosing just one, you will be able to watch all on demand after the event. We will reconvene back to and final remarks. Thank you.